Funds are only for setting up an insurance exchange system here in Kentucky. The tip of the ice federal grant money that will inevitably strip you of your rights. A meeting was held here today in Frankfort to discuss the formation of these insurance exchanges and their effect on
the rates are based upon those pools. When you get other people involved into the system, especially younger people, it's designed to drive down costs.
So basically, the younger folks who are healthier and tend not to need insurance as often as some of the rest of us, you're going to build this system on the backs of those folks to spread the cost.
That's what it is, and that's what we're trying to follow.
I thought that's what we were here to discuss.
Again, we're here to follow the law and to continue with the planning. Excuse me. Do you have another question?
My only question was that you just mentioned again an efficient system, but we've spent none of the grant money to determine what an efficient system looks like.
Accenture, who is an actuarial firm, has been working to try to predict some of the movement that we'll have come 2014.
Is that information available?
It's not finalized yet. We're still working on it.
But we're in the process of creating a structure in the state of Kentucky, and we don't have all the research done yet?
We continue to move forward.
And I want to emphasize that it is not a law. The Supreme Court will only hear acts of Congress if they consider them to be potentially a violation of our Constitution. 26 states in this wonderful country of ours have already joined in a suit to try to overturn it. Once the federal money stops coming, which it will, because we are going to become very dependent upon them to get this program going, but then we're going to run it in the end, and we're going to run out of money in future years to do that. And I want to know what your plans are to pay for all of this in the years ahead. So,
you want to know an answer?
There was a question mark at the end of that. Question mark. You know, we have support for an exchange.
And I'm 23 years old, and I do not want to subsidize everyone else's grandmother's insurance. Has no authority under Article 1, Section 8 to force us to buy anything. The Federalist Papers and the founders of our great nation said the states are the protectors of our liberties. Where is this Commonwealth in defending my liberty?
Health care for approximately 10 years. Now, I didn't have any problems, and I'm happy with the fact that I had the choice of not buying insurance, because if I had been forced to buy insurance, I would have been. I believe that it's up to people to take care of themselves and to try to take less risks. There are going to be a lot of people that aren't going to have money for anything else. You are doing the exact opposite of what this country was based on. And that's people taking chances, people running their own lives, not the government running their lives for them.
Okay, I don't want the government, the state, or the federal putting their hands on my health care and telling me when I can die or live.
I'm Adams. I'm from Nicholasville. Watched this come together, and on the federal level, through the legislative process. There's been no legislative process here in Kentucky. Law clearly states, if you read the Affordable Care Act, it clearly states that the health insurance exchanges are optional. A lot of the people who are here with me today, we demand that the Beshear Administration stop trying to cram this down our throats. Yes. Send $60 million back to the federal government. And that's not a question. Thank you.
Thank you. Next is head to the next two areas.
You're going to cut me off.
Oh, come on.
You're going to cut me off.
It was for 2 hours.
Ma'am, who regulates the health insurance industry in the state?
Do you have a question?
Yes, I do. Who regulates the health insurance industry in the state? Who says which insurance companies can sell insurance in this state and who can't?
Leave the Department of Insurance.
So it's a state organization, correct?
Yeah.
The Department of Insurance is
Right,
yes,
so
part of
the
state
state
government.
regulates the insurance. When my child got cancer and her rates went up and up and up until my husband's employer couldn't pay it and they had to bounce us down, that was okay with the state because the state regulates the health insurance industry, correct?
Correct.
And when it got bounced up and up and up on the next one and we got bumped down again, and we have bounced all the way down to the cheapest policy available in this state, and we're on Medicare for part of her insurance because it's okay with the state of Kentucky. Now, if the state of Kentucky is okay with that, why should I trust the state of Kentucky to regulate any other insurance? Now, I was a teacher in this state. This state had a completely funded teacher retirement system. Where is that money now? It's been spent. Who did that? The state of Kentucky. Why should I trust the state of Kentucky to regulate an insurance exchange when they can't regulate the programs they've got? My child has cancer. This is not academic to me. When we were in school, we were taught that there are three branches, co-equal branches of government that regulate, that nullify each other. Each has the power to stop each other. But we were not taught in school, because it was just about disbanded in 1913, that there is a fourth branch of government that's supposed to stop the others, and it's the states. I want the states to stand up and stop it, not go along with it. You have the right as the state to say no. You can stand up to Obama and say no, and I expect that.
I just had a quick question about whether abortion is part of the mandatory coverage. I would like to hear it from your mouth, yes or no? No, I will not have to pay for the murder of a child. I'm sorry, it's what?
I said there's been no decision. The hearing,
No decision.
The open public hearing was here today to solicit comments regarding benefits that would be
Okay,
included. So yours is so no.
Then I think I speak for the mood of the room here that we do not want abortion included in that.
And they need to hear it until we need to blow them out. We can do that.
Seriously, people, pay attention to what's going on around you. We here at freedomradio.org will try to keep you updated as much as possible on what's going on in your world and in this state, in this country and in this state, and even in this town in particular. But of course, we are a small crew, and we'll do what we can. Also, just to let you know, I am currently looking for any help that we can get with the website, with articles, with anything, graphic design. We've had offers of help from fellow InfoWars contestants, from Facebook fans, and I try to discuss possibilities with everyone as much as I can. I get busy sometimes, but we would love to have your input, because this is supposed to be an example. freedomradio.org is based upon we the people and our liberties, and the defense of our liberties together. E pluribus unum, as one, out of many, one. And that's what we're trying to achieve here. So please, feedback. Don't call me and tell me that you don't like my voice or you don't like the way my hair looks. I don't care about that stuff. We don't care about that stuff here. If you have some actual input, please let me know. I would love to get you on the air. If you got something good to say, to get you on the website. If you got something good to write, we need to band together and join in the fight against these government intrusions, which are becoming absolutely ridiculously excessive at this point. Join us right here again soon for another edition of the freedomradio.org's Freedom Files, where we will keep you informed of the current and imminent threats to your personal and individual freedoms. And until next time, fight the power, because the power is already fighting you.